I'm just performing my hand hygiene here. Hi, my name is Andrea. I'm a nurse practitioner student that's going to see you today.
Hi.
How are you doing?
I'm good. How are you?
Good. I'm good. And what's your name?
I'm Audrey.
Audrey. Nice to meet you. What brings you in today?
Well, I'm having this right ear pain.
Okay, right ear pain. And Audrey, could you tell me your name and date of birth?
Audrey Stewart, 4389.
Okay. So Audrey is a white female, and she's here for right ear pain. So when did the ear pain start?
A couple days ago, I was at the lake swimming, and it just has gotten worse since then.
Okay, so it started after you went swimming at the lake. Okay. And did it happen all at once, or was it more gradual?
Kind of gradual, but I noticed it that night because after I went home and I was like, okay, my ear hurts, and then it just kept getting worse.
Okay. And is it only the right ear?
Mm-hmm.
So no symptoms in the other ear?
No.
Okay. And then have you had any injury or any foreign objects in your ear?
Sometimes I clean my ear with Q-tips.
Okay. And when was the last time that you did that?
About a week ago.
A week ago. Okay. And then can you show me where exactly on your ear where it hurts?
Like the whole ear just hurts. Like it all hurts.
Okay. And then is the pain constant or is it more intermittent?
Well, it's pretty constant. It's usually about like a 7. But if anything touches it, or if I touch it, it goes up to like a 9.
Okay. Okay. And then what does the pain feel like?
It just was kind of full. Like my ear's full. Like it hurts. It's pretty achy, but it.
Okay. Okay. And then you already went over sort of what makes it feel worse. Does anything make it feel better? No? Okay. And is it worse at night? No? Okay. So I'm just trying to rule out necrotizing external otitis. And with that severe pain, it gets worse at night usually. Does that pain travel anywhere?
No, it's just right there.
No? Okay. And then have you had ear aches like this in the past?
I don't think so. Maybe as like a little kid, but nothing I remember.
Okay. All right. And then you already rated your pain 7 out of 10, with 10 being the worst pain. And then people you're around, has anyone else been sick or had earaches like that?
I don't think so.
No? Okay. And then have you noticed any other symptoms?
I don't think so.
No? So you feel fine otherwise?
Yeah, I did. I mean, it just really hurts.
Okay. And then have you ever been diagnosed with any past medical issues at all?
I don't think so.
No? Okay. So with that, we're just looking to see if she had skin conditions or allergies that might put her at risk for this type of ear infection, as well as if she was immunocompromised, which she denies. Any surgical history?
No.
No? Okay. And then what about family? Has your mom or dad have any ear problems?
I don't think there was any ear problems. I know my grandma kept saying something about her heart, like she had high blood pressure or something.
Okay.
And I think my dad has high cholesterol, but that's about it.
All right. And then this is just questions about your wellness exams. So when was your last dental exam?
About 6 months ago.
Okay. And did that look normal?
Yeah, everything's great.
Good. Okay. No cavities? Okay. And then when was your last pap smear?
About a year ago.
And was that normal?
Yeah.
Okay. And what about eye exam?
I've had one of those in like 5 or 6 years.
Okay. Have you had any changes in your vision? No.
No, that's why I don't go.
Okay. All right. And then mammogram or colonoscopy, has anyone talked to you about getting those yet?
No, I don't.
Okay.
I don't. My parents don't have any GI issues or no breast issues for anyone.
Okay. And then now I'm just going to ask you some questions about medications and then just your social history.
Okay.
So do you take any medications, including over-the-counter medications or vitamins or supplements?
I take a vitamin every day, and I took some ibuprofen earlier today.
Okay. And then do you know what dose the ibuprofen is?
Well, I took 4, so I think that's 800 milligrams.
800 milligrams. And how often are you taking?
The bottle says 6 hours, so I'm going right at 6 hours.
Okay. Okay. And then any allergies to medications or food? Any environmental allergies? No? Okay. And then what about any tobacco or drug use?
No.
No. Any alcohol use?
Yeah, I drink when I go out with friends.
Okay. How often would you say you have a drink?
Well, this week it's been 4 or 5 nights this week, but usually it's only like 2 or 3.
Okay. Okay. And then how big would you say your drink is? Just like
It's usually like a can of beer, maybe 2.
Okay.
Maybe a glass of wine.
Okay. And then what do you do for work?
I work at a clothing store.
Okay. Are you liking it?
It's alright.
Yeah. Okay. And then are you living alone or do you live with anyone?
I live alone, but
Okay.
I have 2 dogs and a cat,
Okay.
so it's not really alone.
Do you feel safe at home?
I do.
Okay. And then are you single or married?
I'm single.
Single. Okay. And then do you eat a healthy diet? Do you feel like your diet's pretty balanced?
I'm trying to improve. Yeah.
Okay. Trying to improve. And then do you exercise pretty regularly?
I've been working on that too.
Okay. Awesome. Sounds like you're making some good changes. How often would you say you exercise?
This week, not at all, but the month before that, 3 or 4 times a week.
Okay. Okay. And have you had fatigue or is it just because you've been busy?
Just with the busy stress stuff, nothing out of the normal.
And then just a couple questions we're just required to ask you. So have you any thoughts about hurting yourself or anyone else? No? Okay, great. And then do you have any, well, you mentioned you had dogs. Have you had any recent travel at all?
No.
No. Have you been in contact with anyone that's traveled outside the country? No? All right. And then now I just have it'll seem like 1,000,001 questions, but this is just to help me determine what's going on with your ear. So have you had any weight gain or weight loss, fever or chills? No?
No.
Any problems with balance or coordination?
No.
No, okay, so that's ruling out inner ear infections. She already denied any recent illness or infection. Have you had any headaches?
No, I mean, just this side of my head kind of hurts because of the ear.
Okay, okay. Any loss of consciousness or dizziness? Any injury to the head?
Not that I know of.
Okay, all right. And then she already denied changes in her vision. Do you have any discharge coming out of either of your ears?
I don't think so.
Any hearing loss or like muffled sound in your affected ear?
I don't think so.
No, okay.
It all sounds normal.
Okay, good. Any itching? So sometimes itching could indicate a fungal infection of the ear, which she does not have that symptom. Any ringing of the ear?
No.
Okay. All right. And then have you had any recent deep sea diving or flying?
I wish. No.
I know, that does sound fun. No, okay. So with that, I'm ruling out barotrauma, which is the high pressure that it exerts on the ear, can damage the ear. And then have you had any nasal congestion or drainage? No, okay. So I want to rule out upper respiratory infections and sinus infections. Any sinus tenderness?
I don't think so.
No, okay. Nosebleeds? No, okay. And then throat-wise, have you had any popping or locking of your jaw or clicking when you open or close your mouth?
I don't think so.
No, okay. With that, I'm assessing the TMJ, the joint in her jaw, because sometimes that can refer pain to the ear, which she denies any of those symptoms. And then lastly, for the throat, do you have any throat pain recently or trouble swallowing? No, okay, so that might indicate again an infection in the throat. Have you had any swollen lymph nodes at all or tenderness to those?
Not that I'm aware of.
Okay. Any pain or stiffness in the neck? No. Any shortness of breath or wheezing?
Nope.
Pain upon breathing?
Nope.
No. And then lastly, any chest pain or palpitations? No. Okay, so great. She answered all my questions in regards to her review of symptoms. So vital sign wise, Audrey's temperature that I just checked is 98.6 degrees Fahrenheit. Her respirations are 16. Her heart rate's 72. Her blood pressure is 128/70. O2 set 99% on room air. And then Audrey, when was your last menstrual period?
Last month.
Last month, okay. And then she already said her pain level on her right ear is 7 out of 10 and her left ear does not hurt. Her height is 5'7" and her weight is 60 kilograms. So now I'm just gonna do the physical part of your exam. So I'm just gonna look you over.
Okay.
So we'll start with the head here. I'm gonna come behind you so we can see. Okay. So first I'm just gonna look at, in real life I'd probably have a stool or lower the table. So I'm just gonna look at Audrey's head. I'm looking for any abnormalities in regards to the skull, any lesions, bumps, bruises. So her skull is normocephalic, so meaning she doesn't have any signs of trauma to the skull. Any tenderness when I touch your head?
No.
No? Okay. Okay, so all of that is normal. And then, let's see, we're gonna move on to the eyes. So first I'm just gonna look at the outside of your eyes. Okay, try not to block this. So I'm just gonna pull down here. So her conjunctiva is pink, which is normal, moist. The sclera of her eyes is white. So all that looks normal, no signs of infection, nothing of concern there. I am going to shine this light into her eyes to check for pupillary reflex. Let's see. Okay. So her pupils are at 3 millimeters. That constrict to 2 millimeters. They're equal, round, and reactive to light. And then I am checking for the red light reflex here. So that is intact in both eyes. So that's good. Okay. Have you had any itching or anything of the eye?
No.
No, okay. So all that looks very good. Her pupils are accommodating. Can you follow my finger here? Okay. And then can you tell me when to stop when you see my hands?
I can see it.
Okay. So her peripheral vision's intact. And then when she followed my finger in, her pupils are accommodating. And then let's look at your ears. So I'm gonna look at her external ears on both sides. Her upper auricle is in line with the outer canthus of her eye, which is normal. There are no lesions or abnormalities on the outsides of her ears. Let's take a peek at the other one. Okay. And then I'm just gonna look into her ears here. Okay, so I have a cover on this in real life. So this is the ear that is not painful, so we're gonna look in there first. The adults, you typically pull up and back. So I'm looking at the external ear canal, and there's no obstruction, nothing of concern there, no lesions. The tympanic membrane is pearly white, easily visible, no redness or swelling, so that looks very good. Any tenderness on that side?
No.
No? Okay. So let's take a peek at the other ear. Okay. So I noticed when I pull a little on her ear, she's grimacing. This is a cardinal sign of the external ear infection. The tragus of her ear is also causes pain there. So externally, her ear canal has some thick white exudates. It's just some edematous there in the external ear canal, and some redness. The tympanic membrane is still pearly gray and intact. I don't see any perforations, and no redness of the tympanic membrane. Are you doing okay there?
Yeah.
Okay. All right. So definitely the red ear is looking a little red there. So now I'm just gonna peek up your nose here. So I'm just gonna shine the light up there. Can you sniff for me? So her nares are patent. So I'm just looking again for signs of infection. Sorry, still look up here.
Oh.
No signs of drainage. Her nasal mucosa is pink. No lesions noted. Okay, and now I'm just gonna look at your external mouth here. No lesions. Okay, say ah. Okay, tongue looks good. No lesions on the tongue. Her buccal mucosa is moist, pink, intact. Can you lift the tongue to your roof of your mouth? frenulum. That is intact, no lesions. And then could you move your tongue side to side for me? Very good. So I'm assessing her tongue is midline. We want to, of course, determine if there's any cranial nerve involvement or signs of stroke. And then the uvula is midline. And then she does not have her tonsils. She got those removed. The fossa is pink, moist, intact. I don't see any abnormalities of the throat. Her dentition is great and no signs of abscesses or dental caries. So everything there looked good. Any throat pain? No? Okay. Let's see. Okay, so now we're just gonna move on to your neck. And you mentioned you don't have any pain or stiffness there. So I'm just gonna feel the trachea looks midline. Can you swallow for me? Okay, so no problems swallowing. And then I'm just gonna feel for your lymph nodes here. So the pre-auricular and the post-auricular. She does have some tenderness back here, I've noted, when she's grimacing. That's pretty normal with the ear infection. Her lymph nodes are still small, mobile. And then, let's see, submandibular. Those are almost non-palpable. They're mobile and non-tender. So the neck looks good. And then I'm just gonna take a listen to your lungs here. Okay, so I noticed that her respirations are even and unlabored. Can you take a deep breath for me? Go listen under the right arm. That looks good. Any pain on the chest? No. Her lungs were clear to auscultation. I did not notice any wheezing or extra sounds. Now I'm going to take a listen posteriorly. Oops. Sounds good. Now we'll listen to the heart. So aortic, pulmonic, Erb's point, tricuspid, and mitral. And then I would listen to the apical pulse for 60 seconds, which her heart rate is 72 and regular, so that's great. Any chest pain or palpitations? No, okay. So in the heart, I heard S1, S2 sounds, no murmurs or extra sounds. Her pulses, her carotid pulses are 2+ bilaterally, they're regular. She is ANO times 3. Her mood is very pleasant. She's denied any changes in mental status, and I've noticed that her facial movements are symmetrical. And then her skin is warm, dry, intact, and I didn't see any abnormalities. So again, looking to make sure she has no skin conditions, because that could put her at risk for this ear infection. So my 3 differential diagnoses would be otitis externa, aka swimmer's ear, which is pretty apparent, I think, that she does have that in the right ear. Symptoms for that, usually it's unilateral, pain upon movement with the tragus, and then the outer ear. The TM is intact. She does have some drainage. Sometimes there is hearing loss, but with her, since she denies any hearing loss, the whisper test would not be required. If she did complain of hearing loss, we would do the whisper test and then move on to the Weber and Rhine if she was positive for that. But I'll just do a whisper test just to go ahead and demonstrate it while I have time. So with that, I'm just going to whisper a sequence. I'll give you 2 numbers and a letter, and you just repeat it back to me.
A13.
Okay, and then let's try the other ear.
B54.
Okay, so awesome, she did great. So that's what we would do if she was complaining of hearing loss. And then my second differential diagnosis is trauma. This often presents as otitis externa in regards to symptoms, but since she did have the direct trauma from the cotton swabs, that could have been a diagnosis which I ruled out because she said that was more than about a week ago when she last cleaned her ears. Barotrauma I ruled out because she hasn't had any high pressure situations such as flying or deep sea diving. And then my final differential diagnosis is referred pain from infection of another site. So an example of this would be upper respiratory infection, sinus infection, a dental infection such as an abscess, or TMJ pain. So I've ruled all those out with her signs and symptoms, and then her history and physical. So, all right. Well, do you have any questions for me?
No.
No? All right. Well, thank you very much.